Paul Juarez from Harris Medical College, and we're talking about what we earlier described as youth violence and intentional homicides or intentional injuries. And I think we've more than anything brought that topic from simply youth violence to talk about societal violence in a real sense, Doctor. And so let's continue our discussion here, Doctor.
Well, one of the things that I've learned to really appreciate is that dealing with violence, youth violence in particular, from again, a healthcare perspective, we use the public health model and a public health approach, and it provides a way for, and that's why it's called intentional injuries rather than just violence, is that we can understand that the outcome often results in an injury, and that injury was intentionally inflicted, and then using the public health approach, we try to break it down to look at what were the causes of this. Now, some of those causes may be personal, behavioral aspects. Somebody was, again, it could have been, again, got into a fight, they were angry, or there was a bad, it was a crime or something involved. But we need to look at the event, and you have a victim and a perpetrator. But you can look at the individual characteristics of what is it about those individuals that led to this event. But you can also then, so it's called the agent-host environment model. And so the host is the individual, either the victim or the perpetrator. The agent is the mechanism of injury. How did the actual injury occur? Was it a knife? Was it a blunt instrument? Was it a gunshot wound? And then so you can isolate it and look at, is there something you could do to target that to prevent the injury from having occurred? And then the third component is the environment. And how do you look at environment? Either the physical environment, is it in a, an area that, has, there's no lighting and it's a dark area where people can congregate and you get drug selling, or just makes it more likely for crime to occur, somebody getting mugged, etc. Or is it a park? What is it about the physical environment? Is there something about the social environment as well? So it's this combination of breaking it down and looking at the different aspects of intentional injuries to see, is there some way we can prevent it from occurring? And so that's been my focus, is really looking at prevention.
Very good.
So one of the things that I've been fortunate, I've got a grant funded from the Centers for Disease Control and Prevention to really address this problem of youth violence and intentional injury. And one of the things that we've been able to do is establish, we have several research projects, and I've got collaborators both here from Tennessee State and Vanderbilt that are working with me on that. We have some things going on in the school, some things in the community as well. But one of the real, things that I'm excited about is we also established a community coalition, and it's called the Nashville Community Coalition for Youth Safety. And we have really been able to engage the public sector. We've got the academic community. We've got a lot of community organizations and just individuals who are interested and wanted to be part of this involved. We have over 300 people now. And it's something that we've had some strategic planning, and we've had youth. We get youth involved in helping us to see their perspective. We think it's very important to have the youth voice in the mix. And so they've helped us guide our, in terms of approach. And so one of the things that's come out of the discussions that we've had is we have 3 work groups. One that focuses on youth safety, a second one that focuses on mentoring or caring adults, and a third one that focuses on job training and work opportunities. And so we're using those 3 areas to prevent youth violence. And they all have different, they're all important. Youth violence has multiple causes, and so we need to have multiple interventions. But, getting the community involved is a really important part of this.
And so there is a societal kind of thing that we can do other than, and I think that this would be less expensive in terms of what we're trying